finding is that 1 in 4 of us at some point in our life will suffer from a mental health issue. And mental health can be everything from poor mental health at a specific time, or to an ongoing diagnosed mental health condition. So it could be bipolar, it could be something that's a kind of, a recognised, medically diagnosed condition that's not necessarily going to go away, but that is able to be to medication or talking therapies, or different kinds of therapies can help at different points. So very much it depends on the person's situation, it depends on how they're doing. Quite often it's very difficult to get statistics because some people are not willing to talk about mental health, and that's an issue for society as well. We don't talk enough about mental health generally. And quite often, in a way, people might mask mental health problems with trying to sort of use maybe drink or drugs to perhaps self-medicate. Because if you know you're feeling bad and you're feeling depressed or suicidal or any of these issues, the way that you might make yourself feel better might be through drink or drugs. But actually, what we try and work with the person on is not just about, it's working holistically. So you're working with the whole person. And also very much with kind of health agencies, so hospitals and drug agencies and specialist mental health services as well. So what you're trying to do is help the person to really, talk through some of the issues, but also at the same time, perhaps medically, with medications or with coming off some drugs, manage their own physical sort of health better as well. There's quite a lot of interaction between physical and mental health.
It was 2015, so a year ago, and I was working in housing actually in Southwark, and I became ill because I had mental health problems, and I was signed off work. I stayed in a shelter for a while, and then I became really unwell again. I ended up in hospital, and from then I was put in temporary accommodation, and from temporary accommodation into this hospital here. Because as much as friends that they try and help a little bit, but everyone's got their own lives they have to lead, and they can't often help you with some more practical things like the benefits and stuff like that. In terms of advice, I can't give any because I'm not sure really what I could have done differently up until the point that I ended up in hospital, in which case I think that could have been prevented and it could have been